Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Benign prostatic hyperplasia. So what are the characteristics? It is age related. It can be endocrine controlled. Then there is multifactorial processes, most common site being the transitional zone. So in cut section of the BPH, there is the epithelium, there is a stromal component, that is the collagen smooth muscles, as well as there is a rich adrenergic nerve endings which are seen. Then comes the testosterone. The testosterone is converted into the DHT which acts on the epithelium, and there is a 5-alpha. The 5-alpha reductase inhibitors. 5-alpha reductase inhibitors that can inhibit the conversion. Next is the management. The management depends on the predominant component. That is, the stromal component is predominant. There is alpha blockers. So there is alpha blockers, and they are given for the relaxation of the smooth muscles. Next is the epithelial component is predominant. And here the 5-alpha reductase inhibitors are given. Then comes alpha blockers. The alpha blockers are instantaneously active. Then comes the 5-alpha reductase. They take a minimum of 1 month to show the effect, and with maximum effect seen after the 6 months. Next is the secondary changes which are seen in the bladder due to the DPH. That is the increased force of contraction, increase in the force of the contraction. So there is collagen deposition as well as the detrusor muscle hyperplasia. Then comes the detrusor muscle hypertrophy. Now let's look at the clinical features of the BPH. This includes obstructive symptoms. So obstructive symptoms is there can be poor flow. The poor flow as well as the stream. There is hesitance, there is intermittency, incomplete bladder evacuation, the dribbling of urine, and the postvoidal residual volume. Then there is irritational symptoms, that is irritative symptoms that can be frequency, urgency, as well as it includes the nocturia. So this was the clinical features of the BPH. Then moving on to the International Prostatic symptom score. So score varies from the 0 to 35, and in case if it is mild, it is 0 to 7. In case it is moderate, it is 8 to 19, and in case it is very severe, it will be 25 to the 35. Now let's look at the investigations of the BPH. The investigation, it is uroflowmetry. So uroflowmetry is to document the obstruction. So to document the obstruction, you have uroflowmetry. The normal if the Qmax is greater than 15 ml per second. So then you have the cystometry. The cystometry is to confirm the diagnosis, and then this to confirm the diagnosis and the bladder pressure. This is greater than 80 centimeters of the H2O. Then we look at the medical management. The medical management, it includes the preferred treatment, that is it includes the alpha blockers. Then comes the second line. The second line agent, it includes the 5-alpha reductase. 5-alpha reductase inhibitors, and example is the finasteride. So the preferred treatment is the alpha blockers, tamsulosin, and second line agents, that is the 5-alpha reductase inhibitors, example being the finasteride and the dutasteride, and the combination treatment. So what is the combination treatment? It includes the alpha blockers. Alpha blockers are seen, that is a 5-alpha reductase, and for patients with the large prostates with the high PSA levels. So what are the indications in case of the surgical innovation? This includes there is no improvement, and the medical treatment. There is a recurrent UTI, that is urinary tract infections. There is hydronephrosis, as well as there can be bladder stones, presence of bladder stones, and there can be gross hematuria can also be seen. There can be refractive urinary retention as well. Now, how is the surgical treatment? Surgical treatment is, they can be gold standard, that is the TURP is a gold standard, that is the transurethral resection of the prostate. Then comes the techniques used for the TURP. There is the Nesbitt's technique. Nesbitt's technique means it is preferred, and then you have the Moore-Mayer. Moore-Mayer technique can also be used. Then for irrigation, if you see, it includes 15% of the glycine. 15% of the glycine or 15% or 1.5%. It's not 15%, it is 1.5% of the glycine. Then comes the complication of the TURP. This includes a retrograde. So there is a retrograde ejaculation. Retrograde ejaculation, that is about 75% of the cases. Then you have also the impotence, that is in 10% cases, then the incontinence. Then we move on to the retrograde ejaculation. This can occur due to the injury of the internal urinary sphincter. Then comes, what are the late complications? Late complication is, they can be the bladder neck stenosis and also the urethral strictures. So what is the TUR syndrome? The TUR syndrome is also known as the water intoxication and also the dilution hyponatremia. So dilution hyponatremia. Now, what are the predisposing factors? Predisposing factors, it includes the prostate size. So what is nothing but the prostate size? It is greater than 35 mg. And then comes the surgery duration. The surgery duration is also high. Then comes clinical features. It includes dizziness, as well as there can be confusion, and there can be fluid overload as well. There is visual abnormalities which are seen, and also the bradycardia. Visual abnormalities, bradycardia, as well as the hypertension. How is the treatment? Treatment is the furosemide, and this is nothing but the DOC, that is the drug of choice. If no response, the hypertonic saline can be used. If no choice. Now let's look at the TUIP. The TUIP is nothing but the transurethral incision. This is of the prostate. So the procedure is, there is a Collins knife which is used to make the two incisions. This is at 5 o'clock as well as the 7 o'clock position. There is a suitable for the prostates, and this is up to the 20 mg. And these complications are like the retrograde ejaculation and also the impotence. Then is the open prostatectomy. This indications, it includes the size of the prostate, and this will be greater than 75 mg. This includes the bladder stone, the bladder diverticulum, as well as the types. The types, it includes the Freyer's. Type is the Freyer's suprapubic prostatectomy. Then comes the Millen's retropubic prostatectomy, as well as the Young's perineal prostatectomy. Then the HO-YAG laser. HO-YAG laser is used for the BPH as well as the renal stone procedures. To learn and grow daily like this, please do subscribe.